Good afternoon, and thank you for joining us today. I hope all of you enjoyed a safe and small Thanksgiving. Many of you certainly heeded our advice for a limited Thanksgiving dinner, and we sincerely appreciate that on behalf of the County of San Diego. We know it wasn't ideal, but it's the best we could do under these very trying circumstances. As we turn the pages of our calendar, we know that December is a very special month with a lot of special holidays to enjoy. But this year, we need to celebrate the holidays as safely as possible. This is not the year for caroling. This is not the year for ugly holiday sweater contests. This is a year for sitting on the couch with some hot cocoa and watching your favorite holiday specials on television. I don't want to be the Scrooge delivering that message, but the reality is that COVID-19 cases are surging across the nation, across the state of California, and certainly across San Diego County this winter. Coronavirus is like a snowball rolling down a hill, picking up more and more snow and getting larger and larger. We don't want to be buried in that avalanche. So what can we do? Well, of course, you know the drill by now. Wash your hands, wear your facial coverings, avoid large gatherings. Also, we are still conducting testings throughout the region, and I urge you to take advantage of these tests. There's 2 new county COVID test sites that are opening this week. On Monday, November 30th, there was a walk-up, no appointment testing area that was set up that operates from 8:30 a.m. to 3:30 p.m. every Monday, and this is beginning at this past Monday at Oceanside School District offices at 2111 Mission Avenue. On Thursday, December 3rd, tomorrow, drive-up testing will be every other Thursday, starting at the Northgate Market, which is at 5403 University Avenue, from 8:30 a.m. to 3:30 p.m. Our good friends at CAL FIRE are doing testing starting today from 12 noon to 2 p.m. at Santee City Hall. The CAL FIRE will be providing the tests on a rotating basis. The next couple of dates that they will be at the Santee City Hall is on December 8th and December 29th. We urge you to call 211 or get on the 211 website to find out the availability of testing locations throughout San Diego County. And on Sunday, the county will also begin offering no-cost flu vaccines at the Tubman Chavez Center. This will take place every Sunday in a tent in the parking lot in accordance with health protocols to keep the two activities separate, the testing versus the flu vaccinations. You know, it's amazing, but so far we've had over 1 million residents in San Diego County take advantage of the seasonal flu vaccine shots. This is encouraging. This is way ahead from last year. And it really kind of sets the pace for what we hope will be a rollout of the vaccines for COVID-19 once those get disseminated. Let me take a moment to thank the San Diego County Fire Authority for pioneering the safe rollout of simultaneous testing and flu vaccinations at many locations that they are rotating around San Diego County. For more information, again, our website, coronavirus-sd.com, or 211's website, and go to the testing portion of the website. Now, as you've probably heard, there is help on the way. Vaccines will soon be shipped out across the nation, including here in San Diego County. Our county will play a vital role in the storage and distributions of these vaccines to hospitals and medical providers. But it's not going to be as easy as walking up to a clinic and getting a shot. We'll be following the federal CDC guidelines and making the first doses of the vaccine available to healthcare workers on the front line and individuals most at risk living in long-term residential care facilities. Most San Diegans will not have access to vaccines until early or mid next year. That's why it's so important for us to continue with our safety measures. We're going to hear more about the vaccination efforts from Dr. Wooten today, and we'll get an update on the pandemic from her and Supervisor Nathan Fletcher. Later, we're going to hear from Chris Howard, the Chief Executive Officer of Sharp Healthcare, who will talk about the crippling impact of this pandemic on local hospitals and our healthcare workers. Before we continue, I want to take a moment to recognize the terrible milestone we just passed within the last couple of days, and that is over 1,000 deaths from COVID-19 right here in San Diego County. I urge you to take a look at the San Diego Union newspaper this morning and see the photos of some of those who unfortunately have lost their lives to this pandemic. Each photo tells a story. Each death touches the lives of so many people, families and friends of these individuals. And each of these individuals is a fellow San Diegan, maybe your friend or neighbor. Yes, the pandemic has hurt businesses and upended our way of life. But let us not forget the true cost of this pandemic is in the lives of those 1,000 plus San Diegans who are no longer with us. For them, for our loved ones, let's continue working to end this pandemic. With that, let me introduce Supervisor Nathan Fletcher.
Thank you, and good afternoon. As Supervisor Cox mentioned, we join you today with a heavy heart. The significant increase in cases obviously leads to a significant increase in hospitalizations, and then sometimes later, as is happening now, we begin to see an increase in the loss of life. We have surpassed the 1,000 residents of San Diego County who have died as a result of coronavirus, 1,035 to be exact today. And you know, throughout Thanksgiving, and we anticipate as we head into the holidays, there's a lot of debate and discussion with individuals who say, well, I want to spend the holidays indoor with my families because that's what we historically and traditionally do. And I think it's important that we remind ourselves that there are more than 1,000 San Diego families who will not be spending the holidays with their family members, not because they're making the decision to be responsible and be safe, but they're not doing it because their family members are dead. And we are not asking San Diegans to give up every holiday forever. We're asking San Diegans for this holiday season to please join us out of a commitment to preserve life, out of a commitment to protect our region, to make responsible decisions as we head into the holidays. These indoor gatherings and settings are the highest risk, most dangerous ones we face. There's also the reality that with exponential growth, COVID-19 is everywhere. And the probability of having multiple people indoor for a gathering, it is very likely that someone there could be positive, and given the concern around indoor settings, it is very likely that it will transmit. And so we have to do everything possible. We do see a light at the end of the tunnel with the vaccine, but we know this is going to take many, many, many months into next year. And so we have to come together as a community, knowing that there is hope on the horizon, but knowing that we have to slow the spread now. We have trajectories in cases, in hospitalizations, and in deaths that are very concerning and alarming, and we have to take action now to help our region through this difficult period. We also know that there is a delay, meaning even if everyone in San Diego County today committed to do everything right to slow the spread, we are still going to see an increase in cases coming. We expect the situation to get worse before it gets better. That should not be discouraging. That should be additional motivation to each and every one of us to make the individual choices that we need to make. It is very likely in the coming days we'll continue to see increase in cases, particularly coming out of Thanksgiving. Those will inevitably lead to increase in hospitalizations and increase in loss of life. But again, it doesn't mean that the actions we're taking today are not working. We just know it is going to take time for them to work, and we continue to plead with the public. Please see what is happening to our hospitals, our ICUs, our deaths, and have it motivate each and every one of us one more time to beat back COVID, to slow the spread, to get us back in a positive place, and really lay the foundation for vaccine distribution that we know is on the horizon. But we have to accept COVID is real. Despite everything we are going through, we continue to face pockets of resistance to things that we know work, like utilizing the face covering and masks, avoiding those indoor settings, physically distancing from non-household members. What you're seeing play out before you today, both in San Diego and across the country, is demonstration of how serious this is. And as we've done before, our ability to control our spread. We have flattened this curve before. We did it initially, we did it again in the summer. Now we have to do it one more time as we head into the end of the year and the potential of a vaccine arriving. But again, that vaccine is going to take many, many, many months. And so we have to confront the situation we face today with intentional, focused efforts. I do want to thank Chris Howard, who's here, the CEO of Sharp. Our hospital system partners have been incredible allies, advocates, the folks who are on the front lines confronting the realities of COVID. We appreciate them. We appreciate Chris and his team and all of our healthcare system partners for what they're doing. And we look forward to some insight around challenges they face and concerns they have around where we are going. We also know there's been considerable attention and focus around the issue of religious services and churches. And to be clear, we recognize the important role that religion plays, the important role that faith plays in our communities, particularly in times of great difficulty, which is why under the state's color-coded system and under the tiered system, religious services are treated differently. Religious services, because they are constitutionally protected and because they are critical and foundational to many members of our society, are allowed together in unlimited numbers in outdoor settings. That people are not allowed together in unlimited numbers in outdoor settings to watch a baseball game or do something else, but religious services are treated differently. But they have to act in a responsible manner. And for the overwhelming majority of religious services out there and faith communities who are acting responsibly, we say thank you. My wife and I attended Mass this weekend in an outdoor setting with physical distancing, with requirement of face coverings, with a priest who delivered a message of care for the least among us and the most vulnerable, with a priest who said it is our duty and obligation to protect one another, it is our duty and obligation to wear the face covering, to physically distance, to help save lives. And for those responsible entities out there, we say thank you. For other entities that have chosen to act irresponsibly, entities in particular like the Awakened Church, where we have been forced to have to share outbreak information because of their lack of cooperation in notifying the members of their congregation about cases there, we continue to implore the public to recognize the very real danger of indoor religious services, the danger of spread, of increase in cases, and what it can lead to. And so again, we recognize the vital role that faith plays, and faith is a group of individuals of shared belief who might have a building, but that building does not constitute the faith. There are responsible ways to meet both virtually in online settings or to do it in outdoor settings, and we continue to implore the public to please help us slow the spread and save lives. When I get through the numbers, I will touch briefly on some of our efforts around the vaccine distribution. This is a collaborative effort driven primarily by the CDC and the state of California. As a county, we stand ready and willing. We've been working, planning, collaborating, coordinating, working with our health system partners, investing in infrastructure, whether they're ultra-low temperature freezers, data systems, other things that we may need to prepare to move forward. In addition to engaging with the clinical community, we continue to engage with the community at large to help build confidence in the delivery and execution of those. We know that we will need a significant number of San Diegans to be willing to accept the vaccine, and in order to do that, we have to work, again, collaboratively, following CDC guidance, working under the direction of the state of California, and coordinating and supporting our healthcare system partners. And I'll walk through a few slides related to that after I get through the numbers around some things we're doing, and we'll be sharing more in the coming weeks around our efforts to prepare for the vaccine, and Dr. Wooten will also address it as well. But a key point to keep in mind surrounding the vaccine is it is encouraging, and it should be a sign to all of us that there is hope on the horizon, but it is going to take significant time, many months before we have the number and the volume we need to truly come out of this. And so we can't let the potential for a vaccine distract us from the very real obligation we have today to come together and slow the spread. With that, let's jump into our numbers for today. You can see there our 7-day average of testing remains incredibly strong. This is a great testament to our partners, our healthcare systems, our public health labs, our partnership with Helix. Over 18,000 tests per day is our daily average. Percentage of positive has increased significantly. You can go back and remember this was in the 2s and 3s. So we have seen a significant jump here in the percentage of positive. So the increase in cases is not just because we are doing more testing. We are seeing a higher percentage of the people being tested being counted as cases. And then total tests reported right there, you see us closing in. Probably tomorrow we'll surpass the 2 million tests that are being done. Under the tracing, when you have a surge in cases, it's natural you create a little backlog of the 7-day average of investigations initiated within 24 hours. We are working to address this. We're bringing on more staffing. We're training. We're seeking everything, and we think we can catch this up. We've been through this before. We will get this back under control. I do want to differentiate case investigations as the process of helping determine where individuals were. The close contacts, we remain good there. That is our ability to reach out and contact those folks who were exposed. The two go together, but our close contacts tracing is again performing well. Case investigations has slowed a little bit, and we are taking action to catch that up. And then you can see the treatment numbers there on the right-hand side. Our testing turnaround times, which you'll see on the next slide again, remain strong. This was a situation we encountered at a previous surge where we saw these go to unacceptable levels. Our healthcare system partners are doing great, between 1.5 and 2.5 days. Same with our public health lab. Our county Helix partnership and state walk-in test sites continue to turn those around quickly, and we do view the importance of turning around tests quickly as vital to notify people in order to have an effective contact tracing and close contact system process. Total number of cases today, we are reporting 1,217. Again, it is not the day-to-day totals, it's the overall trends, but there you can see the significant jump in number of cases where we are frequently over or at 1,000 cases, which is vastly different from when we were in the 200 to 300s. And then you can see the purple line there is percentage of positive, which is tracked up considerably in the preceding weeks. Of course, the increase in cases will inevitably lead to an increase in hospitalizations, which you can see reflected here. We have seen almost a doubling in hospitalizations from the highest point we saw in the summer surge that we had. You can see there the ICU COVID numbers are increasing. The total non-COVID hospitalizations are increasing significantly, and this represents a significant concern. And what is most concerning about this is what is to come when we get to that 2 to 3 week mark away from a lot of the significant increase in cases. And this is the focus of our effort and intention, is to preserve the integrity of our healthcare system, and that's why we continue to implore the public to help us slow the spread. The next slide you will see here represents the COVID cases versus the total. Chris may speak to it a little bit more, but we have benefited a little bit from some slowdown, and we've also benefited from our healthcare system partners making adjustments to try and ensure that capacity is there. And so we're grateful for them. As you see the significant increase in COVID, we have maintained overall healthcare system capacity, but there are limits to how far that can go and how much can be done with that, and we appreciate their efforts. And then finally, on ICU capacity, you can see us now sitting at 77% of our ICU beds are presently occupied. Again, a mix of COVID and non-COVID patients. I think this is a cause of greatest concern amongst many of our hospital system partners, which is the availability of staffed and equipped ICU beds in order to meet the need of our region. Briefly here, I wanted to talk about our approach to our vaccination planning framework very quickly. Again, we have it in a series of things. We are working to make sure we have a culturally responsive approach to vaccine distribution, working with community partners and allies out there to help build support. There you see some of the community groups, neighborhood coalitions, community-based, faith-based advocacy, labor associations, and many others to help ensure that trusted messengers are a part of the program we're doing, along with working with our education communities and, of course, our healthcare system partners. This is a part of our joint collaboration and communication. But we want to make sure we have a culturally responsive, convenient system. We want to inspire confidence in our ability to execute, make sure that we are ensuring appropriate communication and collaboration, and then ensure that we tackle any issues surrounding complacency with this through all the efforts. We've been planning for many months, again, working with the state, following CDC guidance, and all of those efforts will continue. We also have, you'll see on the next chart here, a clinical advisory group for COVID-19 vaccinations. This is separate from our efforts around engaging the community, but here you see the tri-chairs of this, Dr. Gail Knight from Rady Children's Hospital, Dr. Kadakia from here in the County Health and Human Services Agency, and Dr. Hood, who's been a great leader throughout COVID and has been a wonderful ally. And these folks are all coming together to help ensure the collaboration, the coordination, and build a system that can inspire confidence, along with all of the efforts around acquiring infrastructure, data tracking, everything else. And in the coming weeks, we will continue to share more around the county's efforts surrounding vaccines. That concludes my update. I'll now turn it over to Dr. Wooten for a Public Health Officer's update.
Thank you, Supervisor Fletcher, and welcome everyone to today's briefing. As you all may be aware, local COVID-19 cases have been significantly increasing during the past months. And this is our epi curve. And if you draw your attention to the far right, the last 14 days is the incubation period, which means more cases can occur. And as you will see there, that area is almost double what we saw in late June, early July. So we anticipate more cases will occur. Now, today's count in the next slide is 84,638 cases, which is 1,217 more cases than yesterday. And unfortunately, we have been seeing new daily cases reported in the 1,000s since November 14th. If you can go to the next slide. And this shows the trend of the daily number of cases, with the highest count being on November 27th with 1,859 cases. So as we look at the numbers, we can see that we have reached a significant crossroad, and we must identify individually as well as collectively how the local COVID-19 story will unfold for us here in San Diego County. Now, going back to the next slide, which is going back to the table. Back. Next. Thank you. The demographics for the total number of cases is unchanged despite the increasing number of cases. The age range is from 0 to 107 years of age. 58% of the cases are from the Latinx population. The age group from 20 to 49 years of age remains or is at 57%, which actually is a 1% drop from prior weeks. And the gender distribution is also unchanged, with 51% of the cases being female, 49% being male. And then we have 253 individuals for which we have no gender information. For hospitalizations, 4,726, or 6% of the total number of cases have been hospitalized, and 1,038 of those hospitalized have been admitted to the ICU, and this number is approximately 1.2% of the total number of cases, but 22% of the number of those that have been hospitalized. And that percentage has, again, slightly decreased. The total number of cases include also 1,035 deaths, or 1.2% of the total number of cases, with 16 new deaths reported since yesterday. Of the 1,035 deaths, 988, or 95%, has underlying medical conditions, and this is also unchanged over the past few months. Going on to the top 3 conditions for underlying medical conditions remain unchanged. That includes hypertension, diabetes, and heart disease. In the next slide, with the increase in cases, there have also been increases in hospitalizations and ICU admissions. And this slide shows the entire journey of hospitalizations for COVID-19 confirmed cases only since the beginning of the outbreak. The arrow there is the point at which the federal government, CMS, changed the definition related to hospitalizations. But despite that, the number has almost doubled since mid-July. So locally, I will briefly review the hospitalizations and ICU status during the month of November, particularly 30 days, 14 days, and 70 days. On the next slide, from November 1st to November 30th, there was a 208% increase in hospitalizations over the 30-day period. And in the next slide, 129% increase in ICU admissions for the same period. If we look at the 14-day period from November 17th through November 30th, next slide, there was a 94% increase in hospitalizations for this 14-day period. And in the next slide, it shows the 63% increase in COVID-19 confirmed ICU admissions for that 14-day period. And then in the next two slides, we will, from the period of November 24th to November 30th, there was a 37% increase in hospitalizations for the 7-day period, which also included a 32%, next slide, increase in ICU admissions. Now, as hospitalizations and ICU admissions have also increased, and this is, should be noted that these factors are delayed, outbreaks are also delayed. So since the beginning, in the next slide, of the COVID-19 pandemic, in San Diego County, there have been 956 outbreaks in congregate and community setting locations. To provide context for these outbreaks, 670 or 70% of the outbreaks are now closed and inactive, meaning there are no new cases in the past 14 days. On the other hand, 286 or 30% are still active outbreaks. Of this number, 286 active outbreaks, it includes 26 or 9% of that total being in skilled nursing facilities. 35 or 12% are in non-skilled nursing facilities and other congregate settings, and 225 or 79% of the current active outbreaks are in community setting locations. Now, please note that in the next slide, that the 956 total outbreaks account for approximately 12%, or 9,625 of the total COVID cases that we are reporting today. And in this slide, you can see that we look at the outbreaks by months since March, and November has almost double the number of outbreaks for the month of October. Now, going to the next slide, this slide shows the different settings for these 706 outbreaks, again, from the period of March 25th through November 30th. There are 4 settings that represent the majority of these outbreaks. 239 are in businesses or retail businesses, as you see on the far left. For restaurants/restaurant bars, this is a total of 209 outbreaks, with 145 in restaurants and bars and 64 in restaurants only. There are 61 outbreaks, there have been 61 outbreaks in grocery retail settings and 34 in healthcare settings. Now let's move on to one of our metrics, which is related to outbreaks. And this is our outbreak metric over 7 days. And today, we were reporting 89 total community setting outbreaks for the past 7 days, from November 25th to December 1st. And this represents a total of 416 cases. Now, there have been 18 additional outbreaks reported from yesterday, and this includes, on the list here, 6 in faith-based organizations, 4 in general businesses, 4 in business retail setting, and 1 each in a daycare or preschool, government, grocery, and in K or TK, transitional kindergarten through the 12th grade. Now, Supervisor Fletcher mentioned the news advisory or press release that was issued over the weekend. And I just want to clarify that since the beginning of this outbreak, we have stated that we would not issue press releases unless there were actions for the general public to take. And given the fact that we were not able to identify all of those that were exposed, that particular news story or press release was issued. And again, we've stated that from the beginning of the outbreak, or the pandemic rather, from the beginning of this pandemic. Now, let's move on to the next slide, which focuses on the blueprint for a safer economy. Just wanted to include this to show that we have significantly gone, the entire state has almost gone completely purple in the past month. So it is very important that people understand and recognize that this is really serious. So the actions that are being taken is because the entire state is almost purple. And certainly we've looked at the case rates for the County of San Diego by jurisdiction, and the entire county also is practically purple. So this is very serious. In the next slide, these are the results of the weekly metrics that are presented on the state's website. So our unadjusted case rate, 30.5. It was noted earlier that we've been doing a significant amount of testing, and you can see here that because of the testing that we've been doing, our adjusted case rate is 15.3. Our total testing or positivity percentage is 2.3%, and the health equity positivity percentage, which our staff calculate, the state does not at this time because of the freeze on the tier system. There's no movement in either direction at this time. And this is for the period of November 11th through the 17th. Now, in the next slide, until a COVID-19 vaccine, and there are 6 that are in track to be approved by the FDA, until these vaccines are available, and obviously in the news, all indication tells us that we will have vaccines in about a week to 2 weeks. We are urging that everyone get their flu vaccination. And December 6th through the 12th is National Influenza Vaccination Week, and we encourage everyone 6 months of age and older to get vaccinated. And the purpose for this is that getting vaccinated helps to protect our hospitals from being oversieged by individuals that are developing complications due to the flu. So again, there is still time to get your flu shot. Now, in the next slide, just want to provide some additional information and clarification about the roles and responsibilities at the federal, at the state, and at the county level. The Centers for Disease Control and Prevention is the lead on determining the priorities for who receives vaccines and allocating vaccines to the state. And then moving up to the next level, the state, California Department of Public Health, allocates vaccines to counties. The vaccine is distributed by the manufacturer. Our staff helps healthcare systems enroll into the federal COVID ready database, and that vaccinations then will be delivered directly to providers that have registered. And the county also has registered, and we will get an allocation, and I'll share that information with you shortly. The state also provides training tools and support to counties and enroll, as I stated before, and helps the local counties enroll providers. At the county level, it is our job to complete the state's template for the vaccination plan, coordinate enrollment, as I stated before, in the COVID ready database for healthcare providers, coordinate COVID-19 vaccine clinical advisory group that Supervisor Fletcher has already discussed. That's our local advisory group. The state also has an advisory group. And also locally, we will receive and store the vaccines that are allocated to the county, directly to the County of San Diego, which is done with other vaccines as well. So we will receive our vaccines and then begin the process of vaccinating all of the populations as identified in the priority list. And then provide vaccinations also to vulnerable populations in partnership with our community. In this next slide, I just want to state that California anticipates getting approximately 327,000 COVID-19 vaccine doses in mid-December. San Diego County anticipates receiving approximately 28,000 doses. And this is just the first round because we will not get all of the vaccines at one time. And given the fact that the Pfizer vaccines, the vaccines that need to be placed on ultra-low temperature freezers, that's the first allocation that we will get. But as other vaccines are approved, we will get allocations from those supplies as well. And we anticipate that the second round of vaccines is likely to follow within 3 weeks after our first round. So on this slide, this is the phases that the federal government has identified for how the vaccines will be administered. Yesterday, on December 1st, the Advisory Committee on Immunization Practices, which is a federal committee to the Centers for Disease Control and Prevention, tweaked the prior recommendations of the National Academy of Medicine. And as you'll see here, particularly focus on the bold text. In phase 1, there are 2 components, phase 1A and 1B. 1A is focused on healthcare personnel as well as staff and residents from congregate care facilities. So that 28,000 that we're getting will have to go to this category, which means there are far more than 28,000 individuals in this first phase. So the healthcare personnel, the state has, or the federal government, and the state is sharing that information with local health departments. That is divided into 3 tiers. So we will have to prioritize this component, healthcare personnel, across 3 tiers. So our staff and our community partners will be working on that, and that certainly is something that will be discussed in our upcoming community advisory vaccine committee, our clinical advisory committee. Now, the other ACIP, again, the Advisory Committee on Immunization Practices, met yesterday to look at just phase 1A, and they will continue to meet to look at these other phases. But as of now, this is how the phases play out. Phase 1B will include people with underlying medical conditions. And then we have phase 2, which includes teachers, school staff, child care workers, food supply chain workers, critical workers that provide essential services to our society, and then residents in congregate livings. That's moved over to the 1A. So we can strike out there. This was the old determination. And then people in and staff working in correctional facilities, as well as all older adults, if they had not been vaccinated in phase 1. And then phase 3, children and young adults, 30 years of age and younger, and then critical workers that were not vaccinated in phase 1 and 2, and then phase 4, which will most likely occur in the spring, March, and April. Anyone then who wants to get vaccinated would be able to get vaccinated once we're in the phase 4 determination. So let's go to the next slide. I think it's important, and Supervisor Fletcher mentioned this, but everything that we do, particularly in the agency, health equity has been a priority since 2008. And just as we lead with equity in all of our other programs and services, we will do the same thing here. And this includes prioritization. It will include communication, outreach, and counseling, as well as access to immunizations or our vaccinations. We want to also make sure that we include the concept of the Healthy Places Index, or the lower quartile, to determine where vaccines are offered. So we will continue that same process as we have done with testing. Now, if you've heard me say, and I'm sure if you've listened to these briefings before, you've heard me say this before, there are evidence-based strategies that we must and need to adhere to until vaccinations are here, and we can achieve herd immunity with at least 60% of our population being vaccinated. In the next slide, that includes washing your hands, staying 6 feet apart from others, wearing the facial covering, and most importantly as well, those are preventive strategies. If you are sick, what's important is do not go to work. And if you do become ill, or if you believe you've been exposed to others who are ill, it's very important that you get tested. And then again, once the vaccinations are available, getting your vaccination for COVID-19. Lastly, if you traveled or gathered with others this Thanksgiving, we encourage that you please get tested and follow the same preventive strategies that I've just reviewed. So with that, I'd now like to welcome to the podium Christopher Howard, who's President and CEO of our Sharp Healthcare System. Thank you.
Thank you, Dr. Wooten. And I would just like to take a moment and thank not only our county supervisors, but all of the staff of the county for the amazing work that's been done over the last 10 months as we fight a once-in-a-lifetime pandemic, not only here in San Diego, but across our country, but right here in our own hometown. The work has been amazing. The camaraderie between the county and our local healthcare providers, significant, best in class, truly, as we look around the country at other collaborations. This one is special. So thank you for all the work that you all have provided to us. I have but a few brief points today that I'd like to make, and I'll emphasize many of the points that have been previously made. But the headline is this: the escalation of COVID-positive patients in this county is very real, and it is a very real threat. We want to think that we are past the greatest part of this challenge with vaccines on the horizon. We are at the beginning. And I know that's disappointing to hear. Nobody wants to hear that. But it is the truth. And we're going to need your help, the public's health, in the coming weeks, coming months, as we all work together to survive this. And we are talking about survival. We're at a crossroads here in San Diego County. I speak on behalf of all the healthcare providers, not just Sharp Healthcare, but all of our wonderful healthcare providers. The crossroads that we were at back in May when we had our first surge, and we thought we managed it. And then we had improvement till we reached July, and then we had July 4th. And then we had our next surge, and we managed it. Improving care practices, protocols, every step along the way to get to this point where we thought we were ready for anything. Putting in that perspective at Sharp Healthcare, back in May, we had our first surge. We had 145 positive COVID patients in our hospitals collectively across San Diego County. The number declined till July. After that surge, we had 130 on average. And then we had a good stretch. Numbers declined precipitously, where on October 25th, across all Sharp hospitals, we had 53 COVID-positive patients. Our number, as of today, is slightly under 300, almost a six-fold increase in a little over a month. And that's before we see the surge that we know is impending. The surge that was mentioned as a result of Thanksgiving activities, congregating, not wearing facial coverings, not maintaining social distancing, all of those things that we know are best practices to prevent viral spread. And so now we face that. We not only face it within our hospitals and our traditional acute care beds, but within our intensive care units. And this is where we are primarily concerned. We're concerned with ICU capacity, and we're concerned with staffing. Staffing across all beds, for sure, but especially within our intensive care units. Putting that into perspective at Sharp Healthcare, we have 184 adult ICU beds in action, in play today. We have 25 beds left in the midst of what we believe over the next 30 days will be the most monumental surge of this virus that we've experienced to date. In effect, everything we are experiencing now is what we feared we would experience back in May. And frankly, that's taken its toll on not just our hospitals, but all hospitals. A month ago, San Diego County hospitals had 180 patients hospitalized with COVID. Today, we are over 740 with another 50 suspected, almost 800. That's serious business. And it's happening for a distinct set of reasons, ones that we'll talk about here in a little bit. Our region has approximately 8,000 hospital beds, but there are only 800 intensive care beds. At the end of November, around 560 of our region's ICU beds were occupied. That left us just 260 beds region-wide. That is continuing to decline precipitously on a daily basis. Now, we're managing this as healthcare providers do. We work our way through challenges, and we are working our way through this challenge. We're flexing procedures and capacity everywhere we can. We don't call them elective procedures anymore. Elective procedures were those things back in March and April that people were putting off because we could. Many of those conditions today are no longer elective. They're necessary, and the question is, to what degree are they necessary? Must they be done now? And so it's no longer elective, but necessary. We're managing that. We're managing our personal protective equipment. You're not hearing the same overarching concern of personal protective equipment across San Diego County hospitals that you were hearing months ago. It's not that they're plentiful. There are in short supply in some areas, but we've all worked hard to be able to manage that as we move forward. Truthfully, our top concern is staff. And it's not just do we have enough staff, that is a top concern. It is a concern for the wear and tear that these individuals have faced, not just for the last 9 months of COVID, because remember, this time last year we were beginning a heavy influenza season. So we've had a high acuity of patient load for a year, people working every day, many with no vacations during this entire time. They're tired, they're overwhelmed, and here's what they are presented with. They are now faced with the worst of this crisis over the next 30 to 60 days. We're all optimistic that vaccines are going to turn the corner. As a matter of fact, I'm very optimistic about that. And I am hopeful when vaccines are available that we will all step forward and take them. That is what will finally turn the corner of this virus for us. But in the meantime, we must be most concerned about our staff, not just the staff of Sharp Healthcare. They show up every single day to deliver the Sharp experience and to provide our exceptional care to patients. The same can be said for Scripps and UCSD, Rady, Palomar, Tri-City, all the other hospital providers in this community. The same can be said. But we must be concerned for our staff. So when you think about what we must do now, my only request is this. This is a simple thing to do. No, you're not forced to do it. But I can tell you what I feel when I walk out and about in our community and I see someone not wearing this because it's their God-given right or because they just don't want to do it. And it kills people. And it makes people show up in our hospitals, and when our staff sees this, somebody not wearing a mask or not staying socially distanced, it's beyond frustrating to people who know at the end of the day what they think is this. This is a pain to wear at times. I think we're all tired of it. You know what's more of a pain? To be a COVID patient in one of our hospitals, or to be talking to the family member of a patient who's about to expire that they can't be there with. That's what a pain is. So our hope, our plea to our community is this. We know you've sacrificed so much. Let's step forward and sacrifice more. Wear a mask, maintain your social distance, wash your hands. If you don't have to go out, don't. Stay home. Do what you can to protect yourself and protect yourself from others. We appreciate it. We appreciate your sacrifice. And believe me, we will be there to sacrifice for you in all the days ahead until we kick this virus. Thank you. And I will now hand it back over to Chairman Cox.
It's a rather sobering message from Chris Howard, the CEO of Sharp Healthcare, but it's a message that is really important to get out. And Chris, I want to thank you, Sharp Hospital, your nursing staff, your doctors, all your staff, and really the staff of all the hospitals in San Diego County. We have an incredible team of hospitals in this region that are all working together, but they need your support. Well, let's get right into the questions. We'll go to the first question.
First question will be from Matt Hoffman with KPBS.
Hi, I know today the CDC issued some new guidance saying while a 14-day quarantine is still the best, new data shows 2 shorter alternatives could work. 1 to 10-day quarantine, another 7-day quarantine with a negative test. People are already reaching out, asking what position the county is taking here. Can you explain what this announcement means for people in our county?
Okay, Dr. Wooten's going to respond.
Thank you for that question. The CDC just released that information, and they are now going from a 14-day quarantine period to a 10-day quarantine period. So it basically means that there's 4 days shaved off the quarantine period for close contacts that would be placed on quarantine if they've been exposed to someone who has COVID-19.
Gotcha. And so that updates now to like workplaces and everything like that, and like schools?
We will be updating our website and sending information out to all of our sector partners and getting the information out. So, and probably it will be included in our end of the day news story today. So we will disseminate information as we do normally so that everyone is aware. And as our contact tracers are talking to individuals that have been exposed and on quarantine, obviously that information will be conveyed at that time, and any letters or communications that we disseminate will be modified to reflect the new guidance.
Gotcha. And then what kind of a holiday surge in testing are you seeing right now? I know you mentioned some very strong numbers recently. And then is the county lab able to keep up with the uptick in tests that are coming in, as in like able to get tests back in 2 or 3 days? I know you guys were trying to get some lab equipment that was back ordered before.
I think Supervisor Fletcher shared with you what the turnaround time is. I can tell you the greatest part of that 6 to 7 day period is the individual getting tested. Previously, it's been about 3.5 days, and we've tried to get the word out to individuals to, if you get symptoms, and in our briefings here today, if you have symptoms, get tested. That's really the important piece. And then let the individuals that you've exposed know so that they can be quarantined and you can continue to be in isolation. So that's really, really important. And this is the information that I just alluded to. And this is the turnaround time for labs from the various partners that are conducting laboratory testing in our county. Thank you.
Thanks.
Okay, let's go to the next question.
Okay, the next question will be from Brandon Lewis with, CBS 8.
Thank you. Thank you. The Board of Supervisors at the meeting was told that the compliance hotline was averaging about 70 calls per day. Can you give us an update on the compliance hotline, what enforcement is looking like at this point, and how long enforcement or how long follow-ups are taking for calls that are placed to the compliance hotline?
Okay, I'm going to ask Vince Nicoletti, who is our compliance officer, to come up and respond to your question.
Currently, the compliance hotline is averaging roughly 250 complaints a day. It is up since we moved into the purple tier. Our priorities remain the complaints regarding anyone that is operating that is prohibited under the purple tier, and our teams are following up within a day or two of complaints coming in.
Thank you. And I'd also like to ask, if I could, given the stark warning that we heard from Chris Howard about the number of ICU beds that are available, why aren't we seeing any further modification to the public health officer's health order?
If you were talking about elective surgeries, is that what you're referring to?
The ICU
or,
beds that are starting to run out, the impact it's having on hospitalizations.
Well, that's not something that can be or needs to be placed in a health officer's order. That really is operations at each of the respective hospitals as it relates to staffing as well as equipment needs. So, but certainly we would help identify ventilators if they were needed, but we have ventilators that are on hand if the various hospitals would need that equipment.
I think maybe I should rephrase it. So given how little capacity, I guess, there is in ICU beds and how strained the hospitals are, why isn't your health order, though, being modified perhaps to curb certain activity? Maybe that's a better way of phrasing it.
I will just chime in briefly in that the health systems are currently managing ICU capacity. When we speak to limited resources right now or limited beds, it's where we are at this point in time. We are all working together as a collective group and frankly already sharing patients with one another when necessary so that we can ensure that we'll all have that capacity down at the end of the day. So we are not at this point with where we stand worried that at least for the immediate future that we're going to have ICU bed capacity and other bed capacity. We're all managing to that. And if we reach a point where it's an extreme circumstance, we will all collect together and find a way to meet that challenge as well.
Okay, we'll go to the next question.
This question will be from Paul Sisson with the San Diego Union Tribune.
Thank you. Follow up on that previous question. I think the point here is that, you're seeing the slope of the line increase. You're seeing a lot more cases than you were. You're seeing a lot more hospitalizations than you were. And, to this point, all of the public health folks, either at the state level or locally, have said, we need to take action before the problem arrives. We need to, so in this context, I suppose you need to pull back on demand before you get to the point where everybody's burnt out in your ICU beds. So I think that is a pretty important question. When in the spring, nobody could go to the beach, nobody could get a mani-pedi. These are all things that are now currently allowed under the purple tier. We could be more prescriptive here in San Diego County if we wanted to be. So the question is, why aren't we returning to more like what we saw in the spring as opposed to the rules that are currently in operation?
Okay, thank you, Paul. Dr. Wooten's going to respond.
Well, Paul, we are in the purple tier, so there are a lot of restrictions there. And we also, as you heard from the governor's briefing on Monday, in terms of countywide and statewide, we anticipate that there will be further restrictions coming this week. So, and then we will follow the guidance that are included in those restrictions.
A question for you about vaccination.
Mm-hmm.
You have clearly a very limited resource here out of the gate. 28,000 doses is certainly, as you said, not remotely enough to vaccinate every healthcare worker and nursing home resident and worker in the county. So you have to pick and choose who's going to be vaccinated first, even within that rather small group. And so I guess what you have to do is a bit of a risk analysis and say who's at the greatest risk of becoming infected. Is that right? Can you talk a little bit about how you guys are going to make this risk analysis? As is it folks in the ER? Is it folks in the ICUs? How do you decide who goes first in a resource scarce environment like this?
Well, thank you for helping further elucidate the slide that I showed about the phases that have been delineated by the federal government. Phase 1A, thank you for bringing that up, is healthcare personnel. And at the top of that list is acute care hospitals. So those are, then that includes psychiatric hospitals as well. So those, and it's not just doctors and nurses, other health personnel that might take food to individuals in their rooms that would have COVID-19, or maintenance or janitors. So those are at the top of the list, acute healthcare facilities. Again, it is going to be very challenging, and we are working out the numbers and working through the process now. But the good news is that first shipment is not going to be our last shipment. So we will allocate as accordingly based on the phase and the tiers within the phase. And I talked about the 3 tiers. Again, healthcare providers are at the top of the list for the first tier as it relates to healthcare personnel.
So it's fair to say then that proximity to the disease itself is really kind of the determining factor early on?
Absolutely. And acute care hospitals is where that's where patients are. And those are the first, the individuals that we want to protect first. As was stated earlier, our doctors and nurses and healthcare personnel are on the front line of responding to COVID-19 and being exposed to the virus. So those are the first individuals that we need to get vaccinated.
Thank you.
Okay, we'll go to the next question.
This question will be from LaMonica Peters with CBS 8. LaMonica? Okay, we'll go on to the next one. This question will be from Will Huntsberry with the Voice of San Diego.
Hey, everyone. I had a question for Christopher Howard, actually. So, obviously, hospitalization have gone up a lot for COVID patients, as you all have laid out. It seems like the amount of other patients in the hospital has gone down over the past month. And can you talk about why you think that is? Are you managing that and doing some procedures that you wouldn't have done otherwise, or is it all just circumstantial? People just happen to be less sick? Do you have any good idea?
Okay, we're going to have Chris Howard respond to that question.
No, it's an excellent question, and the short answer is yes, we're managing that. We also, as I mentioned earlier, what once was referred to as an elective procedure may not be an elective procedure now, and so we are managing very carefully individuals' care and what procedures need to be done. And we also have the good fortune of individuals that are willing to even further postpone unnecessary or necessary but cases that can be delayed. And we also had the good fortune of just having, the good thing about the Thanksgiving holiday is we just had some help there, because individuals don't want to have procedures right in the midst of a holiday or even as they approach another holiday season. So that's helping us as well. But relative to our business at hand, yes, we are carefully managing all activity in our hospitals every day and making sure that we have the capacity that we need to have available to the fullest extent of our ability.
And can you talk a little bit more about staffing for us? You know, I guess hospitals probably are always able to surge staff to a certain extent. You know, maybe you have a bad flu season and you have to do it, but I guess right now, lots of places are experiencing surges. There's a lot of, travel nurses, I imagine, are in high demand. So, like, do you have much ability to make your staffing better than it is right now? And I guess the last way I'll put the question is, you know, I'm not sure how many beds Sharp has. I guess it's probably, I think you said 8,000. I mean, could you staff 8,000 beds tomorrow if you needed to?
So we have about right now a little under 1,800 staffed primary beds. Sharp has over 2,000 beds in general, but for this care in particular, a little under 2,000. And we can staff up to a significant portion of those beds, but right now a lot of it depends on what type of patients we're dealing with. As you can imagine, the higher the acuity of the patient, the more staff are required. A COVID patient takes extraordinary resources. Simply proning a patient, the process of turning the patient back and forth over. You'll have a team of 7, 8 people in the room with many patients, much less all of the tremendous care and safety practices that have to be enacted. So the short answer to your question, though, back to your original question, is staffing is tight, and it's tighter than it ever has been before, mainly because people are tired, they're not volunteering for extra shifts. Travelers aren't as willing to come to San Diego because there may not be as many things to do in San Diego as maybe there might have been otherwise. Everyone is paying a premium for travelers and or other staff. We're paying a premium. All the other health systems are doing that as well to make sure that individuals who are willing to come forth and volunteer for another shift or work additional shifts, that we are paying as fairly as we can to compensate for that. But it's going to be a tough fight. I would be disingenuous if I said otherwise. We're in good shape right now, but we need to make sure we are over the next 30 days.
Right. And
Okay, that completes our call-in questions. We do have a number of texted questions. The first one I know is going to deal with speculation that Governor Newsom may be coming up with some additional restrictions, and we're going to ask Dr. Wooten to go ahead and respond to that.
This first question is from Mario Escovedo with Channel 8 CBS News. Governor Newsom hinted at a statewide stay-at-home order. What would that look like in San Diego? Is that something you are preparing if that is ordered?
Well, we don't have the specifics of what that will look like, and once we get that information, we will then adhere and include it in our health officer's orders, and it will be part of the compliance process throughout the county, looking at if anyone is violating the health officer's order. So I don't have a crystal ball. I don't know what it's going to include, but when we get the guidance, we will right away change our health officer's orders and get that information out to the public.
This next question is from Jennifer Kastner with ABC 10 News. Can you please clarify where the county will be storing the first shipment of vaccines? When will the county get its own freezers, and where will they be placed?
So we're not going to give specific locations, but just suffice it to know, we get vaccinations every flu season and throughout the year of all of the other various vaccines that we order. Right now, we do have one ultra-low temperature freezer, and we've ordered additional others. Our partners have been identified by the state, not by the county, but by the state, so that we do have the capacity to store the 28,000 doses that we will be receiving in the next, after. And I need to point this out. Everyone has it as a foregone conclusion that we'll be getting it, and most likely we will. But the FDA has to first provide the emergency use authorization before vaccines can be shipped. The federal government, or CDC, has stated that once that authorization is provided, shipments will go out within the next 24 hours. So we know that that meeting is on the 10th next week. So we anticipate that we should be getting shipments at the end or over the weekend or in the following week.
This next question is also for you, Dr. Wooten. This is from LaMonica Peters with CBS 8. She asks, how is the county addressing the rise of cases at the jails, and can you explain how inmates might be prioritized for the vaccine?
So the number of cases at the jails have increased slightly, but it is a small increase. So it is not an overwhelming number, and not a number that is not able to be managed. So the cases that are being seen are managed. There are locations for the individuals to be isolated, as well as those exposed to be quarantined.
Okay, and Dr. Wooten, this is a question I'll ask you and then probably have our SHARP representative as well step up. This is from Laura Acevedo with ABC 10 News. There are reports that hospital capacity in Tijuana are already at 80%. Is there concern that people looking for care south of the border could come to San Diego and impact the county's hospital capacity? How is the county and local hospitals preparing for that possibility?
Well, I don't think that anything has changed since we've last talked about this with the media. The federal government has restrictions on who crosses, and then it is for essential workers, and it is also for those individuals that are that are residents of the United States, even though they might be living in Tijuana, as well as they are permanent residents or legal citizens. So, and those individuals have the right to come across the border to seek health care. I know Dr. McDonald is here. I don't know if he wants to make some additional comments. He's involved with the committee that looks at this very closely.
Yes, thanks, Dr. Wooten. It gives me an opportunity to say that our local unified task force looking at the border it continues to meet weekly, and we do monitor the case statistics in Tijuana, Mexicali, Imperial County, and in San Diego. Actually, the number of individuals crossing the border requiring ambulance transport is actually slightly down last week compared to previous weeks, although the percentage of individuals who have COVID suspicious illness is up slightly. We're not aware that there's a significant burden that is taxing the Tijuana hospitals at this time. And Dr. Wooten is 100% correct that only individuals who are legally allowed to cross the border can cross for care. Those who seek care are 95% U.S. citizens or legal permanent residents.
This next question deals with the fact that the courts have allowed strip clubs to continue to operate until an injunction is dealt with. And Supervisor Nathan Fletcher is going to respond to that.
This question is from Mike McKinnon with KUSI News. Can you explain why strip clubs are allowed to stay open, and can other businesses file similar lawsuits to remain open?
The county public health order directed strip clubs to close. They sued. A judge temporarily overruled the county order pending further hearings. In other instances, the county public health orders closed indoor dining at restaurants to close. They sued. The judge sided with the county and upheld them. And so anyone can certainly sue for anything they like, and we will follow the advice and guidance of judges in those instances when they weigh in.
Supervisor Fletcher, there's another question for you. This one is from Alexander Nguyen from KPBS. Is San Diego considering banning outdoor dining as Los Angeles has done? Also, because of the Supreme Court ruling on religious services, will that affect how the county will go about dealing with the outbreaks at the Awakened Church?
Yeah, in relation to the first one, I think Dr. Wooten's addressed this. We're going to follow the guidance from the state of California. We expect it's possible they may have some additional measures come out sometime this week, but we'll continue to look to them for guidance around appropriate steps. As it relates to the second one, the Supreme Court case that was ruled related to a specific instance in the state of New York, an instance in which they're not even presently doing, so it does not have any bearing or application on the tiered systems or what we're doing in the state of California.
Thank you, Supervisor Fletcher.
Well, thank you. That completes our questions for today. We're going to be obviously back next week, next Wednesday at 2:30, but I would also remind everyone that on Tuesday, we'll have our final San Diego County Board of Supervisors meeting to deal with COVID-related issues. At that time, we'll have a detailed update, and you'll be able to watch and participate in the meeting online. So until then, please protect yourself and your fellow San Diegans by wearing those facial coverings and maintaining that social distancing and avoiding large crowds. We sincerely thank you for your participation today. Thank you.